This webinar is being delivered and watched from various ancestral homelands of Indigenous peoples across the province, each with their own unique traditions and histories. Myself, I'm an uninvited guest on the unceded homelands of the Tsleil-Waututh, the Musqueam, and the Squamish First Nations. And whenever you hear land acknowledgement, I hope that you honor the people of the land and reflect on the ways to disrupt the ongoing injustices of colonization still happening in Canada. I'd like to also send my appreciation to BCMPHA's education sponsors who make these webinars possible, including BC Housing. And now I'd like to introduce Carrie from Shift Collaborative.
Great, thanks, Jackie. And you can just stop sharing your screen. That'd be great. Hi, everyone. My name is Carrie Klein, and I work with Shift Collaborative, and we've been doing work with health authorities and municipalities and partners all over the province on preparing for and adapting to the impacts of climate change, and that includes increasing temperatures and things like wildfire smoke. So I'm joining today from my home on the ancestral territory of the Lekwungen-speaking peoples, the Songhees and Esquimalt nations in Victoria. And I'm really happy to be here today and facilitating this session today. So I am going to share my screen just to give a bit of background about the purpose of this session. So we have 3 hours together today, and in that time, we're going to have some presentations and some discussion. We're going to explore which tenant populations are at greater risk to heat and wildfire smoke and why. We'll have some time to discuss what some things have been done to support these populations, some of the strengths, some of the challenges, what's worked, what hasn't worked, what lessons have been learned to support these populations in nonprofit housing to stay safe during heat and smoke events. And we'll discuss what some of the practical implications are for nonprofit housing providers to bring more of an equity lens to heat and smoke response. And we have some really great presenters joining us today. So we have an hour and a half. We have till 11:30, and here is a little bit of an outline of how we'll spend our time together. So in a moment, we'll get a sense of who's here, who's joining. And then we'll hear from Dr. Sarah Henderson, and Dr. Henderson is a scientific director with for Environmental Health Sciences at the BC Centre for Disease Control, and she's also an associate professor at the UBC School of Population and Public Health. And then we'll hear from a couple of different nonprofit housing providers in the province on their experience with heat and wildfire smoke response. So we'll hear from Jenny Robinson. She's the executive director of Nelson Care Society in Nelson, and also from Avery Taylor, who's the director of operations from the Portland Hotel Society in Victoria. And then BC Housing has developed some practical tools to use in pre-summer season heat assessment, and they're directly managed buildings. So we'll be hearing from Louise Rowland as well as Doug Schell from some of their experiences and some tools that might be helpful for others. So I know we've all been on Zoom a lot in the last year, but just a few quick reminders to ensure that this is the best experience for you and for everybody. So just a reminder that we're co-creating the space today, and I really invite you to bring your questions and your comments and ideas into the discussion. We'll have some presentations, but also some time for questions and answers. And you also feel free to use the chat function. So the chat function, just as a quick reminder, there's a button in your bottom menu of Zoom, and there's a chat button, and you can click on that to post, well, you can try it right now to introduce yourself and your name and your affiliation and maybe where you are in the province, but also to ask questions or post links or comments throughout the session. I'll be monitoring that. And I invite you, if you're comfortable with it, to keep your video on during the session. It's really nice to know that there's other humans, not just a screen, that we're in a session here together. So that would be great. But I do ask to remain on mute, just because that interferes with some background noise. And feel free to unmute if you would like to ask a question or participate in the discussion. So to get started today, we have a few polling questions to learn about who is here. And there are two ways to access the poll. So the easiest way is if you have a cell phone with you handy, if you turn your camera on and point it at the screen, a browser should open up on your phone, and there should be a poll that will turn up. And the other way is to click this link, and I'll put it in the chat right now. Yeah, so I see some people in there already. So if you can also follow that link, and that will open a browser on your computer. I will share the results with you live. There we go. Can you all see that? The results from, yeah, great. So where are you joining from today? It looks like there's still some coming in, but quite a few from the lower mainland and some from Vancouver Island and some from the, maybe one from the Kootenays and from the interior as well. So welcome. No one from the north today? Oh, there's a few more joining. That's great. And the next question that you should see is, to what extent has extreme heat impacted the populations you support? So if you just take a minute to respond to that, just a few options of a great deal, or maybe moderately, maybe it's rare, you haven't really seen extreme heat impact the populations in your building yet, or maybe you've never really seen that in the parts of the province that you're in yet. Just give a minute to have a few others join. So most people, it sounds like it's something you've noticed that's in a moderate amount. Okay. And a few, about 4 people, it's a great deal. So love to hear more about that when we get to the discussion part of the agenda. So the next question is, to what extent has wildfire smoke impacted the populations you support? So curious how you've noticed in the parts of the province you're joining from, how wildfire smoke has impacted your populations. So far it looks like people have noticed a bit more, a great deal, that wildfire smoke has been more of an impact than heat. So that's interesting, and we'll have some more discussion about that. So thank you. So just keep that browser open. We're going to come back to the polls a little later in the discussion. I'm just going to share this back here. Great. So before we dive in today, I just wanted to introduce this lens of equity, and it's a word that we're hearing a lot about lately. So we just wanted to explore what it means in the context of heat and wildfire smoke response, and why it's important. And we know that we're not all equally affected by heat and wildfire smoke. There's some people and populations that are more vulnerable than others, either because of their age or underlying health conditions, or maybe their economic disadvantage. But if we design our responses to heat and smoke to be the same for everyone, like for all tenants in your building, we'll end up with something that looks like the picture on the top, right? It might work well for some, but it likely won't be a good fit for many, and perhaps for those that are maybe most vulnerable or most at risk. But if we pay attention to those that are most at risk, if we don't pay attention to those that are most at risk, what will happen is we'll tend to exacerbate or amplify the inequities that might exist already. But if we do consider equity in how we're responding, so if we're thinking about which populations are most at risk, if we're designing strategies and responses that can really respond to their needs, it will look hopefully more like the bottom picture, where people are getting the kinds of supports they need to really stay safe. And we're going to hear a lot more about this in a second from Dr. Henderson, who's going to introduce kind of which populations are in fact most at risk to heat and smoke and why. But there's really 3 things, or 3 lenses that we can put on that are helpful to consider for us to be kind of mindful of how vulnerable some of your tenant populations might be to these hazards. And the first is exposure. So how exposed is your tenant population to heat or smoke? So for example, if it's an unhoused population, if they're sleeping outdoors, they're obviously much more exposed to the elements than if you're living inside. Or if you live in a building that doesn't have air conditioning, you're going to be more exposed to the heat. And the second consideration is around sensitivity. So some populations are just physiologically more sensitive to heat and smoke than others. And Dr. Henderson will be talking about this more. But for example, the elderly, those that are maybe using certain substances, or those with medical conditions like unmanaged diabetes, for example, are going to be more physiologically sensitive to the heat. And then the third is the adaptive capacity of different populations in your buildings. And so this is the ability to prepare for, to adapt, to cope with things like heat and wildfire smoke, and it's very important. So for example, there might be some tenants in your buildings that have low literacy levels, or they might not be fluent in English, or so they might not understand messaging around heat and smoke that might be coming out. There might be tenants in your buildings that maybe have the ability to go and purchase a fan when it's really hot, and clearly there's some in your buildings that won't have that ability. Or some might have a really close social network and they can take care of each other and check on each other, and others will be more socially isolated. So all of these three things together are determining how vulnerable all of us, but also the tenants in your buildings, are vulnerable to things like heat and smoke. And this really matters because when we consider all of these three things together and how they intersect, it allows us to design responses that are supporting those that are most at risk. And that's really what bringing an equity lens into heat and wildfire response is about. So that's just three things you can kind of hold, and it's like an easy framework to remember. I'm going to turn it over to Dr. Henderson, who's going to be introducing some of what we know, what the science is telling us about how heat and wildfire smoke are impacting the province, and also which populations are most at risk. So Dr. Henderson, I'll turn it over to you.
Yeah, good morning, everybody, and thanks for inviting me to be here with you. There's my super boring email, and here's my actual presentation. So I just want to take some time to get folks oriented to extreme heat, wildfire smoke, what we expect to see in the province over the decades ahead as the climate changes, and what the impacts of these different exposures are. And then I'll take a little bit of time to talk about what happens when they occur, because we'll see those conditions more and more frequently as time goes by. So just to give you a bit of introduction to me, I am the Scientific Director of Environmental Health Services at the BC Centre for Disease Control. I've been here for the last 12 years almost, and these two topics are a huge part of my portfolio at the center, and I did my PhD research on wildfire smoke as well. So I've been studying these exposures in British Columbia for a very long time. Again, for each of the exposures, I'm going to talk about what the projections are telling us, what the health effects of the exposure are, or the primary sort of things we need to be concerned about, ways that we can protect ourselves from these exposures, and then how to build kind of equity into the consideration of both extreme hot weather and wildfire smoke. And there's some similarities between them and some differences that are important. So when we're talking about projections for the future, there's lots of different ways we can talk about hot weather, and one of those things is the number of extremely hot days. Another one of those things is the mean anticipated temperature. I really like this construct, which is cooling degree days, because it gives a sense of both the intensity and the duration, but it isn't something that most people are used to thinking about. So a cooling degree day is defined as the daily difference between 18 degrees, which is considered to be a thermally comfortable temperature for humans, and the actual temperature for that day. So you see I've colored in pink here all of the days that are over 18 degrees, and then we would take the number of degrees over 18 and sum them up, as an indicator of the cooling degree days in summer of this particular year. So, you know, if the temperature is 18, there's no cooling degrees. If the temperature is 30, there's 15 cooling degrees. So it's just kind of a measure of duration and intensity together. And I think it's one of the easiest ways or most useful ways to look at the climate projections. These climate projections come from Plan to Adapt, which is a tool that's been developed for British Columbia by the Pacific Climate Impacts Consortium. They have a lot of tools available. Some of the information is very complex and, you know, challenging for folks to access and understand without kind of a lot of technical knowledge. But Plan to Adapt, it tries to simplify all of the climate information and modeling that happens. Plan to Adapt is currently showing projections based on the representative concentration pathway 8.5. So when we run climate models, we run different scenarios for what might happen in the future. 8.5 is the worst case scenario, and PKIC has decided that it's probably the most representative scenario for what we should be planning for in British Columbia. So I am showing you the results for cooling degree days under RCP 8.5, or the worst case scenario, which is 4.9 degrees of warming globally by 2100. So here's, on the left-hand side, we had what was the climate normal for 1961 to 1990. You can see that most of this is pretty purple, meaning temperatures were in summer were around 18 degrees, and then it got hotter sort of through the valleys in the central interior, where it is typically hotter in the province. On the right-hand side, we have what's projected for 2010 to 2030. We're now in the middle of this period almost. And you can see that along the coast, things are getting warmer. Up the valleys, things are getting warmer. Up the Okanagan Valley, things are getting significantly warmer. So this is the first chunk of projections. If we move into the next chunk of projections, which is 2040 to 2069, we can see significantly increased warming throughout the most populated region of the province, the other most populated regions of the province, and starting to show up into the northern areas as well. And then if we look at 2070 to 2099, we see obviously very striking differences. So this is alarming looking, and I know that. I think the message here is that we need to anticipate significantly increased temperatures in especially southern British Columbia, and significantly increased risk of extreme hot weather in the decades ahead, starting immediately. This was sort of our first taste of what extreme hot weather can do in British Columbia. It's quite a while ago now. I've talked about it a lot. I've done a lot of research on this event, but in brief, here we have the daily number of deaths in blue bars and the temperature as measured at Abbotsford International Airport as a red line. And you can see when the temperatures increase, the mortality increases. And the thing about hot weather is the mortality doesn't increase a little bit, it increases a lot. So if we take the 7 hottest days here, we saw a 40% increase in regional mortality during those 7 hottest days. Not a 1% increase, not a 2% increase, a 40% increase. On this particular day, you can see almost twice as many people died as we would normally expect in summer, which is that dashed line. So heat kills people. And I think it's very commonly sort of misperceived, I would say, that heat kills older people. That is very true of the 2003 extreme hot weather event that occurred in Europe. That is not true of how heat has played out in British Columbia to date. Mostly these people are older people, so older adults, I'm going to say in their 50s, 60s, and 70s, but not extremely frail people. But they got into trouble with hot weather because of, as we've alluded to, sort of various underlying susceptibilities to that hot weather. Oh, this is not as clear as I would want it to be, but that's okay. The human body wants to look like this on the left. We want to have a nice core temperature of 37 degrees, getting cooler towards the extremities of the body. When core temperature increases, havoc can be wreaked. So we have sort of a 4-degree threshold around which we can be comfortable, but once core temperature is up by more than 2 degrees, or once it's down by more than 2 degrees, things become problematic. And that is very easy to, that happens very easily in extreme hot weather. So on this side, we have an individual with an ambient temperature of 20 degrees. On this side, we have an individual with an ambient temperature of 35 degrees. And you can see core temperature is now occurring throughout the entire body and is at risk of increasing to a dangerous degree. What happens when our core temperature starts to go up is that the body tries to cool itself down. And this is when you start sweating. So it's one of the primary defense mechanisms that the body has. It's going to send sweat to the surface of the skin, because then we're going to have an evaporative cooling effect when the air comes over the surface of the skin and evaporates that sweat. It is the #1 human defense against being too hot. If you do not have enough water in your body to create enough sweat, there becomes very problematic. And what happens is 2 different things. We have sort of a vascular response to the heat. And if you're not adequately hydrated, your blood gets kind of thick. It's called volume depletion. So the volume of blood that you have in your body shrinks because there's not enough hydration in there, and it becomes very hard for your heart to pump through your blood through your body because it's too thick. And that's kind of really the key feature around why people can die quickly when it gets hot. So hydration is absolutely key to remaining safe. We also alluded to the idea that there are some drugs that do affect thermoregulation or actual perception of hotness. So there can be kind of 2 mechanisms underlying these. One class of drugs is anticholinergics, and these are quite widely used by people with a range of underlying conditions. So it's not a small % of the population that uses these type of drugs, and they do put people at risk. Other anti-Parkinsonian agents, so anybody who has Parkinson's and is taking anti-Parkinsonian drugs is going to be at increased risk. Diuretics of any kind, again, we've talked about why hydration is so important. So if you're taking a drug that dehydrates you by design, it's concerning during hot weather. Antihistamines, and then cocaine and methamphetamines, drugs that really sort of up your metabolic state, can really interfere with thermoregulation. So pharmaceuticals and illicit drugs can put people at higher risk. I guess one of the nice things about extreme hot weather is it's pretty simple to reduce the risk. Staying cool is staying safe. If you can stay cool and keep that core body temperature within a healthy range, you're going to be in a much safer position. Unfortunately, air conditioning is the most effective intervention and not necessarily accessible to all. Again, hydration is absolutely essential. One very easy intervention that we don't often think about in BC because we live in a temperate climate is just keeping your skin wet. You know, if you're in a hot climate, you'll see people dunk a t-shirt and put it back on. That sort of starts fulfilling the role of sweat by providing that evaporative cooling to the body. So wet cloths, wet t-shirts, all of those kinds of things can really help to cool people down. And then there's aspects of the environment that improve things as well. If you're, you know, in a hot urban core without a lot of tree cover, things are going to be hotter. But if there's trees around and water features, those can really provide that kind of localized evaporative cooling as well. So equity considerations here. The health risks of extreme hot weather increase with decreased access to air conditioning. So the kinds of people who have less access to air conditioning are going to be the kinds of people who have higher risk. Physical health status in general, if your health is good to begin with, you're going to be more resilient. If your health is compromised in some way, you're going to be less resilient. And there's a bunch of ways those compromises may play out: heart disease, diabetes, respiratory disease, you know, anything that knocks your health down on a daily basis, regardless of the heat, will make you more susceptible to the hot weather. Mental health status, this is very important when it comes to extreme hot weather. During that 1 week period I showed you in Vancouver, we had 7 suicides. We normally have 1 suicide per week. So extreme hot weather puts people whose mental health is compromised at even higher risk. Decreased access to green space. Green space is highly protective if it's available. Increased urban density leads to higher risk. Increased physical labor, be you working inside or outside. If you have to exert yourself in the heat, you are at higher risk from the heat. Time spent outdoors. So again, anybody who's marginally housed and is outdoors more often and perhaps not appropriately dressed for hot weather is going to be at higher risk. And then use of some drugs. Turning over to smoke now. Smoke is, when we talk about climate modeling, temperature is one of the core things that goes into climate models. Climate modeling doesn't routinely look at air pollution and smoke. It's a very challenging thing to look at. So we have to sort of take some academic studies that have been done to understand what smoke impacts may look like. So this is a study from the US. None of these studies have been done for Canada so far, but we know the Western United States and the Western Canada, you know, we're going to have a kind of similar type output. On the left here, we have the year 2000 and what smoke fine particulate matter, or PM 2.5, look like. We'll talk about PM 2.5 a little more in a bit. And then I'll just focus down here on the, again, the representative concentration pathway 8.5. So that worst case scenario. This is the anticipated change between 2000 and 2050. This is the anticipated change between 2000 and 2100. So looking at a much smokier future, both in Western North America and really across the contiguous United States. That's really because we have hotter, drier conditions, and hotter, drier conditions facilitate wildfire. Just going back here, you can see this is not spatially consistent across places. Smoke is very, very different in different places and different at different times. So I just want to run through a few different locations in BC to show you what smoke's been like over the last 5 years. This is Vancouver region. The orange line is 2020. So we had that smoke event where we had a lot of smoke coming across the border from the US. The green line is 2018, which is the worst wildfire season we've had with respect to area burned. And the blue line is 2017, which was the worst wildfire season we've had with respect to risk to communities from direct wildfire impact. So this is Vancouver. We see, you know, quite a lot of smoke. This is normal conditions down here. If we look at Kamloops on exactly the same scale, we can see that the 2020 event was about the same in Kamloops, but when we talk about 2017 and 2018, we're seeing much larger and much longer impacts in that interior part of the province. And when we look at Prince George, again, not such a big impact in 2017, but that 2018 year, we had smoke really for 8 solid weeks in Prince George. So again, smoke is highly variable. Temperature is highly variable as well, but if it's hot in the province, it tends to be kind of hot across the province based on the weather system. Smoke is more variable than that. When we talk about wildfire smoke, it's an extremely complex form of pollution. We don't measure all the things that probably affect human health, but we do know that these fine particles, or PM 2.5, are one of the riskier components. So if we look at a human hair here, these pink balls are PM 2.5, but when we look inside that, what we really see is these collections of soot balls from the burning material. So they're much, much smaller particles that have aggregated together. And that has impacts because there's a lot of surface area here available to interact with the body, and particularly the lungs when they get into the lungs. And
Sarah, just a 5-minute warning. Sorry,
yeah,
Sarah.
I'm good. I'm good. These small particles get into the lungs all the way. They get right down to the alveolar exchange region, which is where oxygen is exchanged across the lung and into the blood. And your body doesn't want them there at all. So it mounts an immunological response against them the same way it would if there was a bacterium there or a virus there, but it can't kill the particles. And what happens is it leads to a state of inflammation in the lungs, which leads to a state of inflammation across the whole body. So therefore, the whole body is affected by these things in the lungs. There's also those very small particles can translocate across the alveolar sac and into the bloodstream and start circulating in the blood, giving them more direct access to the other organ systems. So I know it makes sense that smoke affects the lungs, but it actually affects the entire body. When we have a very smoky day in British Columbia, this is kind of what we expect to see. The impacts are largely respiratory, and we see big increases in the number of people going to the doctor for asthma, COPD, ear infections, lower respiratory infections, and we see pretty big increases in respiratory mortality. Respiratory mortality is a small fraction of all-cause mortality. So if 100 people die in BC a day, maybe 5 of those deaths would be caused by respiratory causes, but we do see increased number of deaths due to respiratory causes. And then we see slight sort of cardiovascular effect as well, but not as big as this respiratory effect. A lot of people are most at risk when it comes to wildfire smoke exposures. When we add this up across the population, it's at least 1/3 of the population. And if we sort of define it as broadly as possible, it's 2/3 of the population. So it's not a small fraction of people. Anybody who has asthma or COPD or any kind of pre-existing respiratory condition will be at higher risk when it's smoky. People with heart disease, people with diabetes, we're learning that it becomes more difficult for them to balance their insulin when it's smoky outside. Again, people with mental illness, this is kind of a twofold thing. It's emotionally difficult to live under smoky conditions, especially when they last for weeks and weeks. But also remember, we talked about those particles crossing into the blood and starting to circulate in the blood, which means they have access to the blood-brain barrier as well. So there may be direct physiological impacts. Older adults, people who are pregnant and the developing fetus, that inflammation can restrict the placenta and restrict fetal growth. Infants, especially newborns, those who have very, very sensitive lungs, smoke is not what we want them breathing in that sensitive window. Children, they A, breathe more air per body weight than adults do, and B, run around a lot more outdoors than adults do. Those who are working outdoors and really marginalized groups of any kind, especially those who are marginally housed. So it's a little bit less simple with smoke than it is with hot weather, but again, reduced exposure is reduced risk. So when it's smoky outside, we all got to breathe that air. We can't stop breathing. What we want to do is try to reduce the amount of smoke that we're breathing to protect our health as much as possible. Cleaner indoor air is kind of the #1 pathway to this. We spend about 90% of our time inside, most of us. So if we can keep that indoor air cleaner, we're doing a good job protecting people. Effective masks when you're outdoors, which means a well-fitted respirator mask like an N95 or a KN95, or we've learned that a well-fitted 3-layer disposable or cloth mask can also be quite effective. The key point is that the inhaled air has to pass through the material of the mask, not around the material of the mask. It needs to be tightly fitted to the face so the air is going through the material. And then reduced physical activity. If you are out for a run as opposed to sitting around, you're breathing about 10 times more air than you would be if you were sitting around. And that means you're breathing 10 times more smoke under smoky conditions. Here, the equity considerations. Respiratory health status is the #1 risk factor for smoke exposure. So I put that anybody with decreased respiratory health status is at increased risk when it's smoky. Those who have less access to cleaner indoor air, I work in an office environment, I get to come in and spend 8 hours a day in a pretty nice clean place. People who don't have that protection. Physical health status, again, sort of anything that compromises health on a day-to-day basis will affect exposure to smoke. And again, mental health status. If you're, again, physical labor, if you're doing, if you're exerting yourself because of the work that you're doing, you're going to be more exposed. If you're working outdoors, you're going to be more exposed. And then this one's always a bit tricky, but if you smoke or cigarettes or anything else really that does damage to your lungs on a day-to-day basis, the smoke exposure when we have wildfire smoke is probably worse for you than it is if you don't smoke. I know that seems a bit counterintuitive, but again, it's that sort of respiratory health status question. I just want to throw this in because it's recent work out of the BCCDC, and I think it's probably useful for you folks. Portable air cleaners are very effective, especially if they're used in one room for keeping indoor air clean. They're expensive and maybe challenging to access. So we've done some work by just taping a furnace filter to a box fan, and we've found that this can be as effective as a small portable air cleaner. So this is good technology in a small space. They can do a good job of cleaning the indoor air. Finally, when these two things meet. So hot weather causes thermal stress. Wildfire smoke causes irritation and inflammation. They are very different physiological processes. These two exposures can add up when they are happening together, and especially for those people who are susceptible to both of them. That you've got kind of a double whammy when it's hot and smoky. Even so, extreme hot weather is a bigger risk factor for most people than extreme wildfire smoke. And when I say most people, I mean anybody who doesn't have COPD or poorly controlled asthma. So for people with certain types of respiratory conditions, wildfire smoke is going to be the bigger risk. But for most people, extreme hot weather is going to be the bigger risk. And this really comes down to like what I showed you. We see these 50% increases in mortality when it gets very hot outside, we might see a 5% increase in overall mortality when it gets very smoky outside. Hot weather kills people. Smoke can kill people as well, but not the same way that hot weather can, again, because of those different physiological processes. So, you know, if you have these two things co-occurring, cooling should be prioritized and smoke protection should come next, but the ideal is obviously cleaner and cooler indoor air. That's kind of the thing that will help to protect everybody. So that's what I have for you, and very happy to take any questions.
Thank you so much, Sarah. There is a lot of very useful information that you just shared. We probably have time for, excuse me, 1 or 2 quick questions if anybody has any questions for Sarah. And you can also put a question in the chat if you'd like. And if not, I think Sarah's sticking around, so maybe she'll be able to join in the conversation later. I don't see any. So I think, I mean, so much of what you shared, Sarah, I think is just really very important context information for those that are on the call. We're all working with populations that may be in some of those high risk groups to heat and smoke. And so next we have 2 presenters who are going, oh, I do see one question. Yeah, COVID into the multi-hazard. Great, thanks for the question, Tamsin. And I'm gonna move this along, but I know there are some great resources that BCCDC has put out around heat response and wildfire response in the pandemic during COVID. So we'll make sure to get those into the chat. But yeah, I would love to move us along to our next 2 presenters. So we're going to start with hearing from Jenny Robinson from Nelson Cares. And we've invited 2 nonprofit housing providers to speak to just their experience of how have you noticed heat and wildfire smoke infecting the populations you house, and what are some of the things you've been doing and what have you learned that might be useful for others on the call. So Jenny, I'll share your screen for you and I'll let you take it from here. Just give me 1 quick second here. Nope, that's not the right presentation. Just give me a sec. But that is, there you go.
Thanks, Carrie. And thanks everybody for participating today. And thanks, Sarah. Wow, that was, as I said in the chat, amazing, informative, and scary how fast it's happening. And as we live in a very rural area in Nelson, so all of these things are very important. And I'm coming to you from the traditional territories of the Sinixt and Ktunaxa, and happy to be here today. You can flip the slide for me. Thanks, Sarah.
Oh.
Just a couple of highlights, just who we are, business continuity, and the pivot, of course, that the word we've come to loathe over the last 15 months, and Nelson in the summer, and organizational capacity, and who's responsible for what. So you can just flip it, that'd be great. And this is Nelson Cares. We're a multi-service agency, so we live in a rural community, so we're kind of a catch-all for service. We have group homes and community living homes that we provide care and custody for 17 adults with developmental disabilities. We have an employment and inclusion program called Custom Fit, and we have an advocacy center, which is a legal information center. We also have affordable housing. We currently operate 173 units of affordable housing in a rural setting. And then we're also the community entity for the Nelson Committee on Homelessness. So we have a great deal of focus on homelessness and housing. We also provide service through emergency shelter. So the next slide, please. And just some photographs of some of our housing sites. And I'll just comment on Cedar Grove Estates and Copper Mountain Court and Lakeside. These are all currently sites that were built about 30 years ago. Cedar Grove Estates is undergoing a complete redevelopment now, a retrofit, not a redevelopment. And so keeping in mind the changing climate and fire, we've put in a lot of resources that improve interior cooling, exterior. We're changing out our vinyl for hardy planks, so higher fire resistance. We've done a lot of fire mitigation around the sites, removing some trees, making sure that there's safety around the properties, which is a big thing. As you can see from the photograph of Copper Mountain Court, we live right in the forest in Nelson. So a lot of hyper concentration. And Lakeside Place, we've actually, that site is actually under redevelopment right now. And Copper Mountain Court is our next one that needs quite a bit of work. There's no cooling. Yeah, that's okay. Go ahead, Carrie. And the next slide. And this is the new site for Lakeside, and that site will be opened November of this year. So again, at this site, lots of attention to climate change mitigation, really good cooling systems using heat pumps in the development of this building, and really good airflow because this will be a seniors block. And then the next slide is our current new site, which is Hall Street Place, which we just opened last month. And again, same kind of thing, you know, advanced heating and cooling systems, cooling areas in the building. And so it's definitely top of mind for us. And this one is in an urban setting. So not so much concern around the forest area, but still quite a bit of concern around heating and cooling. The next slide, please. And this is where Nelson is. We live very much in one of those corridors that you just showed, Sarah. So we live in a valley area, and we have been experiencing higher and higher temperatures as we come through June, which is Nelson is actually in one of the only inland rainforests in the country. And so we always expect cooler temperatures through June, and grateful to say that this June has kind of been normal for us, lots of moisture, lots of rain, lots of cool temperatures. So grateful coming into those very hot months, but we've now been experiencing July, August, September, these incredible increases in temperature where we're, you know, going into 2-3 weeks without any precipitation and very high temperatures. So next slide, please. So this is a typical summer in Nelson, and then you can just give me the next shot. And this is Nelson in the summer of 2018. This was persistent, heavy smoke for us, and very, very hard for our vulnerable populations. You know, and we expect now every summer, and we anticipate every summer that we're going to face some time where we're in heavy smoke conditions, because we're also in that corridor valley from the Western United States, from Washington State, and we get a ton of smoke. So if there's fires in Washington State, we are the recipient of those smokes. And so it's really, really very difficult in the summertime here now. Next slide. What is our role in an emergency? So I think COVID-19 really, for me, I've been, you know, in the sector for, in leadership roles for the last almost 20 years. And COVID really taught me a huge lesson, which I think basically our role is far greater than I ever thought it would be in terms of emergency preparedness and emergency response. We had our own you know, tools and business continuity and pandemic response plans. But it highlighted to me that the resources for the community and infrastructure for our rural communities is really slim. And us as nonprofit providers, suddenly there was a lot of emphasis on us actually managing quite a bit more than we had anticipated. So that was a huge lesson for me, and really supporting the most vulnerable populations in our community, both you know, people living with disability and people that are homeless. In fire situations, we've always known that we're responsible for the care and custody of our residents in our community living homes. So that means we have to have 24/7 staff traveling with them if we're evacuated. So at the beginning of every summer, we poll our staff. We ask them who would be willing to, if we were under evacuation order, to actually basically care for individuals, travel with them, or find alternative accommodation. And we make these plans for each of our individuals. If they have family, that of course is a huge asset, but many of the people that we have in our care don't have family or have senior members of their family that wouldn't be able to come in and do so. So that for us, the staffing element during these critical emergencies has been highlighted through COVID, but we also do preparedness every year. So we create a plan, we poll our staff, we say who would be working, because basically in an evacuation time period, we would be basically laying everybody off. And so it's an opportunity to be employed during an evacuation period. So that kind of is an enticement, but it's also a very difficult question to ask people. Most people with young children, we know that they would be out of that loop. So we're looking for key staff, and we do that every summer. and we prepare that list every summer. We provide emergency information for all of our independent residents and clients. So we have a little a sheet that I'll show you a little bit of information later on what to gather and what to bring. And then we prepare staff for the duties in emergency situations. So we have these conversations with our teams. We do at our OH&S teams, we start in April on our fire preparedness. We do tabletop exercises with our teams to just remind them of the process of evacuation. And then also just being mindful of your insurance, making sure that it's completely up to date, that you have fire protection for our buildings. And then in the case where we're in construction, making sure our course of construction insurance and replacement values are there in the case of forest fire, because that is a huge risk for us during the summer season and through construction. And just making it part of your annual planning is really important. I'm sure most of you on the call know this information already, but just a reminder. And you can just flip the slide, Carrie, thanks. And the key issues for us for vulnerable populations. So, we do house people that have concurrent mental health and substance use issues. And some of the conversation, our chief of fire actually over the not last summer, but the summer before, after those heavy fire seasons, we came together as a community to start an emergency preparedness plan for the community. We didn't complete the work, frankly, but it was a really great conversation. And I was grateful to be at the table, because I think there's so much stigma around the populations that we support. And we had lots of conversation about, for example, if we were to evacuate into settings, managing stigma, managing othering at sites where suddenly people with a lot of wealth or a lot of access may be commingling with people that are homeless. And how do we manage to protect the vulnerable population in that setting? How do we mitigate for othering, without segregation, and how do we support our people through that? So would we provide staffing supports for evacuation for our homeless populations? Also reaching the homeless population in our area. A lot of people that we serve through the year in the summertime typically go into the forested areas and camp for the summer. And that's also a tricky piece. They also, in the high fire season, there's more vigilance from our CNCP rail line to kick people out of their encampments, police and fire to actually go in and basically pull down people's encampments. And that in some cases, these are sites that people have developed and worked, and we work on safety with our outreach teams to make sure people are living in the forest safely. They're not at risk of starting a forest fire. There's a lot of conversation that happens in the summer with our people that are vulnerable and street engaged, and camping, just to hope that they really observe that, because it really just takes a cigarette to start a forest fire in a really dry temperature area, and around Okanagan as well. Transportation is a really difficult issue that we at the community table talked about a lot, because Nelson is really locked in. We have 2 exits basically, and if we're surrounded by fire, it's going to be very challenging to get out of the region. And how do we get our vulnerable populations out? So we talked, basically we had our conversations coordinated with the school board, because they have access to vehicles. We have some vehicles, but really it takes staffing and people with Class 4 licenses. So some of the things we've talked about is creating a roster of retired fire and police who typically have Class 4 licenses, people that have driven school buses, whether they would be willing to volunteer, and having a roster of people available to transport people, because as we know, most of our homeless populations and vulnerable populations, certainly people with disability, typically don't have their own cars, and we're relying on public transport. So a lot of conversation around transport, and some movement on organizing. That's still, as I've started, it's still an area where I feel as an organizational leader quite vulnerable for our folks if we had to evacuate. And then hygiene services and basic supplies. As we know, our vulnerable populations typically might have a day's supply with them, 2 days supply. How do we ensure that they have? So we have basically a list at our shelter of supplies that we can provide people quickly, with a couple days of food, like non-perishable food, some bottled water, and make sure that they have at least some source of hygiene and basic supplies if we had to evacuate. Harm reduction services in an emergency setting. This is new to us, but COVID was a real big lesson for us, and we did a lot of joint work in our community around safe supply, safe prescribing with our interior health partners, and with Anchors, one of our sister agencies that does a lot of work around harm reduction. And we were actually able to advance the service through COVID because of the lens that was on it. And I think that probably would kick in where we were supporting people with safe supply, and probably working with pharmacy to make sure people have what they need so they're not going into withdrawal as they're evacuating. And again, that goes back to that top point of othering and stigma. How do you manage a population that's on the move, that needs health supports for substance use and other health related issues for mental health in that situation of a heightened evacuation, heightened stressful situation? So I don't have all the answers, but these are some of the things I think about. And just the next slide, Carrie, is just sort of, this is our, get ready. So every year we do a reminder to our tenants to have a grab bag that includes a number of things. And just, you can put up the next slide, which is really dense, but just a reminder to everybody about, and I'm sure all of you have this list, but my favorite is the second from the bottom, which is the whistle. These funny things that we take for granted, but really making sure that you have your phone, you have 3 days of supply, you have extra batteries, prescriptions. So our staff in our community living homes, we actually update our grab bags in April to make sure that everything's in there for our residents. And we send, this is part of our communication to both our homeless population and our residents. And actually, we're just preparing it right now. It's just going to go out to people, and just a reminder to get things together. And then the next slide, Carrie, if you could flip, thanks. And then just the final, if you have time, your valuables, your family photos, personal computers, chargers, and the most important, have a sturdy pair of shoes, a flashlight near your bed during the summer season in case of sudden evacuation at night. And of course, now with the masks and pieces like that, I see that in the chat. Thanks, Sarah. Yeah, we would update for that for sure. And then what happens when we get back home? Because this is the question about recovery. Recovery partnership is so important in that, making sure that, because we may be, different agencies may be affected more adversely. Maybe some of our housing has been destroyed. How do we respond? And the crisis response is for everyone, and including you as organizational leaders, to make sure that we come through it in a healthy manner as well. So that's my very brief presentation. Thank you.
Oh, thanks so much, Jenny. There's, again, so much that you shared, and a few things that really stood out for me were just that you're dealing, in some parts of the province, we're dealing with multiple hazards, especially during the summer months, and heat and is one, but wildfire smoke is kind of a secondary impact, and the primary impact being smoke, wildfire itself.
Exactly. Yeah.
Yeah. And so some parts of the province clearly dealing with like the added just emergency planning that is required for such extreme impacts. I also just really appreciated how you spoke to like multiple factors with your tenant population that would be making them more vulnerable. And you included some of the things that are invisible and hard to see, like stigma and discrimination, which are so critical, and just even thinking about how that might play into their, like the impacts on them when they come to an evacuation center, or for that matter, a cooling center or a cooling room. And is that culturally appropriate? Is there stigma there? Mm-hmm. And then just the third, I'm just really impressed with the amount of annual kind of planning that you shared with your organization, the preparedness, both at an organizational level and with your partners, but then also supporting your tenant population to support them to be prepared individually. So much great information, and just really thanks for sharing all those lessons learned.
Yeah, you're welcome.
So Duncan, we'd love to hear from you. You're in a very different part of the province, and and I know that you've had some unique challenges with the Portland Hotel Society, and also some great successes too. So I'd love to hear from you, and then we'll have a little bit of time for questions for both of them.
Certainly. Thank you all. Duncan Hagan with PHS Community Services, not Avery Taylor from the island. Sorry to disappoint in advance. Jenny, just a wonderful opportunity to build on the medical academic backing and then the on-the-ground performance. One thing that becomes very clear at the start of the conversation is the regional specific interventions important to meet. Quite frankly, one of the core tenets of what I imagine all of us do is trying to meet the needs of the individuals we serve, which, while there may be shared diagnoses or some shared performances, the regionality of that will shift. So from the PHS's perspective, we are more urban centered. Vancouver with 27 years working with marginalized homeless population, and in Victoria over the last 5-6. And wanted to bring forward some of those interventions and challenges that we have faced, both from a programmatic perspective. So if you think about the programs that we operate, so not just homeless sheltering, housing, and things of that nature, but overdose intervention sites, medical services, and outreach services into homeless encampments and otherwise, experienced over years in Vancouver, and then over those performances in Victoria as well. See if I can't share my screen, if that's possible. Can you all see that image in the background? Good to go?
Yeah,
Brilliant.
good. Thanks, Duncan.
So part of the rationale for bringing this forward is that there's a multitude of things we can see. And in a multitude of things that we can see, much like in our heat and smoke based increased concerns, there are a poly number of concurrent disorders that the populations we all serve suffer through. And therefore the interventions, much like the multitude of things we can see in this, need to meet people where they're at, allowing them to be the authors of what those interventions can look like. Quite frankly, I'm speaking to you all from my privileged position in my home in Vancouver. Why would I be an expert in the interventions necessary for somebody living underneath an overpass? So when we actually look at their voices, one of the failings of the things we've had in our sector for a very long time is we've described the populations we serve as voiceless. Few things could be farther from the truth. They're not voiceless, they're just not heard. So I bring that forward in the start of this conversation because one of them is on us to start listening and not having more cis hetero white males like myself building interventions and allowing that voice to be heard. So we're creating spaces like Jenny spoke to previously about what about those otherings and those interventions we make. Because if you create interventions that are suited for me and my family, either me and my family are going to be made often uncomfortable in those environments, or the people we're trying to serve aren't going to access them. And so I don't mean to belabor the point, but I think it's important to start in a place where we go, right, my lens in this work is going to be very different than the lens of the individual I'm trying to serve. Let's see how, there we go. So it leads to the idea of people, not pathology. And if we take a human-centered approach in this work, so over the years, what we've been trying to do, be it as simple as peer-driven hydration teams, so that's paid peer employment on those hot weather days that sees individuals going out into community with water, with other supplies, with accessing people that I will never see. Not only would I not know where to go in many regards, but that I wouldn't be welcome into those places. And so having that person-centered approach where we're taking and honoring individuals who have that expertise in the same way that people on this panel are considered experts, and we're delivering this information. I think the expertise often resides in community, and the expertise of intervention resides in community. And we've been over the years trying to better develop that imperfectly like anyone. And it holds at its core that idea that it's humans first. It's people, not pathology, and that those interventions, be it the hydration teams that have been very successful. It's a paid employment program that goes out into community on those hot weather days, led often by our community monitored alcohol program, so CMAP, knowing that part of while drinking is a liquid, is also a dehydrant, and through this process, and accessing those populations of individuals who know where to go and have the built community and expertise in the field. Moreover, one of the things that many of us on this call from the homeless services approach will know is that we have, for the last decade that I've been in Vancouver working in this field, had heat shelters. Heat shelters are for the months ranging from October through till the end of March. And I think we're in a place where we're needing to develop heat shelters for, heat and smoke and things of that nature, We open our doors in the wintertime to bring people indoors and offer them respite from exposure. And with the ever shifting and increasing temperatures, smoke, particulate fire season, I think it demands that we're advocating and pushing for heat shelters from heat, and that we're opening those spaces up during those really hot, really challenging, really particularly laden days in the summer. One of the concurrent pressures on that is that Jenny spoke to it just before this. Those spaces that we're opening often for normative performed marginalized or poor populations are the community centers, are the library, are those spaces where there is an air conditioning during the, not necessarily 9 to 5, but in and around that time frame. Those are already spaces that the population of the IV, inhalation, drug user, street and trench, trauma, lived experience traumatized individual are excluded from often due to non-normative behavior. And so how do we create and understand a prioritization of individuals with those concurrent health concerns, accessing those public spaces when we're already excluded, and yet the need is an ever increased pressure. So from People Not Pathology, we're looking at it. This is a parklet in Vancouver. This was taken maybe 3 weeks ago, a month ago, from the Drinkers Lounge. Despite ever increased efforts to encourage individuals to wear masks, that is not always a possibility, or people just aren't adherent to it. The reason I raise this is that by bringing something that was considered to be non-normative or problematic behavior, and I really see the air quotes around the term problematic on that, behavior of community-based drinkers, instead of having that dispersed into those hidden quadrants of our cities, hidden quadrants of our communities, out under the viaduct, in the alleyway, what happens if we go, well, wait a second, I mean, later today, I'm likely to drink a beer on my front deck. What if we bring that totally normative behavior and bring it closer to care? And I don't need to focus on the individuals on this or the parklet. I'd like us to focus in the top corner here where there's a door. Because inside that door, on the second floor, there's a medical clinic with a doctor and nurses. There are 3 mental health workers. There's a door just over to the other side here where there's monitored alcohol program where individuals are brewing their own beer, white and red wine. So that hydration we talked about, those monitoring of health concerns that Dr. Henderson and Sarah spoke to earlier, those are achievable. Those are achievable interventions because the humans have been brought into an area and a community of care. And it meant that we were creating client-centered care versus clinician-centered care. And this is a challenging conversation for all of us in leadership, for all of us who are in this field. Because the performance of the individuals that we're serving on a regular basis have at least atypical or referred to as non-normative behaviors, their behaviors often exclude themselves from care, meaning that we've prioritized that the clinician on the hot day isn't going out into the field. We've prioritized that the mental health worker on a heavily driven particulate matter aren't going out into the homeless encampment, into those spaces. And what we've done then, we've prioritized the clinician's care over the client's care. And it's a scourge in our field specific, because if it were any other health concerns, if it were any outside of mental health, trauma and addiction, we would never allow that to happen. And I think it's important that we raise these things, that we highlight and daylight those areas of concern where this expands beyond the Drinkers Lounge, which is a pretty amazing health intervention when we think that we can bring individuals access healthcare where necessary, and have that more normalized in its performance on those hot days, where if we can't offer you air conditioning, we can offer you water and care. And that we're actually looking at how we can better shape these interventions to fit the need. As I opened up with, I'm unlikely to be the individual who needs those interventions. The individuals in community can probably best shape those. And so when we're meeting them and and walking beside them in a fashion that honors that performance of survival, I think we'll find that the interventions are more fruitful and purposeful. Right, I keep hitting the wrong button. So this just speaks to our approach to care, walking beside people without judgment to witness their journey. Pretty simple. That, but in the background there was one of the first heat-based health interventions I had the opportunity to work on, and it actually says needle exchange van. So that doesn't seem as though those jive. What that meant is we were going into community with liters and liters and stacks of water bottles. And quite frankly, it had half to do with harm reduction supplies and much more to do with the simple monitoring of individuals, because we were going to where they're at, instead of this expectations that individuals are going to be able to access services like the library and the community center and the mall that they've already been thrown out of 4, 5, 6 times by security. And those interventions meant that we were seeing what the performance was in the alleyways, in the communities of our neighborhoods, of our city, and trying to shape that intervention. And here's another intervention, which is all through a normative photo from anywhere in North America, particularly on the Pacific West, Northwest. But I mean, there have been homeless encampments across Canada. Montreal's got a 6-year-old homeless encampment. Toronto is 4. I've worked in 5 or 6 in British Columbia, from Victoria, and multiple in Vancouver and Nanaimo of late. And the reason I show this photo, you can tell from what individuals are wearing that it's not quite heat weather, but the year previous in Oppenheimer it was. And creating those spaces where we were going into community, trying to intervene in those hot weather interventions with water, with monitoring, with access to any of those type of preventative interventions that we could, was an important component. I raise it again that we were going to meet the individuals, because quite frankly, those interventions of air conditioning, those interventions of fans, while in our shelters are really important, there's a whole swath, a large swath of the community that those are pretend. And so if we recognize that those aren't actually accessible, what are we going to be doing from our sector? What are we going to be doing for the population of the actual street homeless to intervene? And sometimes that looks like a wet shirt. Sarah Henderson made a very good point. I was thinking about, like, it's right. Like, what about just a bucket of water that people are able to dunk and get clothing wet on those really heavy, hot days where you're sleeping, living, defecating, and existing on asphalt? What are those things that we can bring to intervene? And then I just wanted to bring a closure in this type of thing. The importance of belonging. So the importance of belonging isn't that you come and shape and change your performance to meet my needs. Belonging is you fit. Your voice fits. Your performance fits. Your whatever your notion of wellness looks like fits. And so what that meant is for me, we don't have the opportunity all the time to be building new infrastructure. Jenny, I was envious of your 30-year-old buildings. I was like, oh, 30 years old, that thing looks so new. Because often we're taking 100-year-old single room occupancies. AC hadn't even been a concept to a certain degree at that infrastructure development. And how then can we create belonging in those spaces? What are those health interventions? And when Sarah, you showed me the fan with the filter over the front of it, I thought that's an intervention that could actively be used in those spaces. And more broadly, while we don't have answers necessarily, some of those successful interventions has been the purchase of fans for 1,500 individuals living in our continuum. And one of the pushbacks is, well, aren't you going to see those sold on East Hastings? Right. Well, you guys you have 1,500 fans, you're just going to put them into these rooms. Aren't you just going to see them sold on East Hastings? And our response has always been, great. That means somebody else in East Hastings getting a fan. This whole notion of that people must treat these interventions, these things we offer to them with cap in hand, like Oliver, like, please have some more. That is a failed understanding. If we're going to have these opportunities and seeing interventions, they don't need to look how we want them to look. They need to be effective.
Thank you, Duncan.
So many great points there. And
just something I'm really taking away from your presentation is just, an equity informed approach, which is kind of how we started today. Really is a strengths-based approach inherently. And just, I loved how you spoke about how the peers, like the people with lived experience are the experts on this and what's going to work, and really building the capacity of the populations you serve to be supporting each other. I think is such a great principle in terms of an equity informed way to respond to heat and smoke. So just great examples, great images. Thank you so much.
Thank you so much.
We are running a little bit behind, and we have one more presentation left. I have a quick way that I'd love to just hear from everybody else, just to hear a little bit about what you are doing as well. So if you go to if it was on your phone before, the browser with the poll, or I just put it in the chat again, there's a link that you can follow, and there is another poll up, and it's just asking, what are some of the things that you have done to support your tenants to stay safe and healthy during, first of all, we'll look at extreme heat. So if you just follow that link, or go to your phone again, it should be up there. You can let me know. Is that showing up for everybody? I don't see anyone's participated yet. Is that working? Can you see that? Oh, all of the above was not an option. Thank you. It should have been an option. And you might only be able to hit one, and that was an error. So yeah, so people are doing a lot of things, checking information, developing heat response plans and protocols. That's great to hear and see. Great. Yeah, whoops. More people on, yeah, that's wonderful to hear that people are actually developing heat response plans and protocols. I'll just move us to the next one, which is about what you've done to support your tenants to stay safe during wildfire smoke events. So just quickly, we'll just hear if people have developed wildfire smoke readiness plans, if you've assessed your HVAC systems for smoke readiness. Sarah introduced like temporary or portable air cleaners, some do-it-yourself kind of way to have portable air cleaners, upgrading your HVAC system or sharing information with tenants. Yeah, so looks like there's a few things that people are doing, including sharing information with tenants, which is something that's easy to do. That's fantastic. So you can keep filling that in, and I'm going to move us just into our last presentation. We have about 10 minutes left. So Louise, I will turn it, or Doug, I'm not sure who's going first. We can have both of you up. Louise first, okay, and I'll share your slides on the screen. Just give me 1 second.
Thanks, Carrie.
Just give me 1 second.
Yeah.
There you go.
Okay, perfect. Good morning, everybody. I know we've come to the end of the webinar, so we'll try not to take up too much of your time. I've got a 10-minute time limit here. So a lot of information is very straightforward and basic. Such great information was already covered this morning. So some might be a bit repetitive, but I hope you get some value from it. So Doug and I are really going to talk about the pre-summer preparations tips that we have developed within BC Housing. I just want to mention, for the purpose of Doug and I's presentation, we're mostly referring to what we did within our directly managed subsidized housing portfolios and how we get prepared for extreme weather events or poor air pollution due to wildfires. So here's just a really quick agenda. We're going to discuss some of the aspects like staff awareness, making sure staff have all the resources and knowledge prior to an event in the summertime. Doug's going to talk about the procedure that we developed with this purpose, and some about the roles and responsibilities, as well as inventory checks. Then I'm going to talk about the tenants who we identified as most at risk within our directly managed developments. I'm going to share a piece of a sample of the communication materials that we use at our directly managed developments. And then at the end, I'm just going to finish with some additional resources that we can show you, or where you can find them if you want some extra information. So I'm going to pass it over to Doug now, and he's going to take it on for the staff awareness.
Hey, thanks, Louise. Can everybody hear me okay?
Yeah, I can hear you.
Good.
Great.
Okay, so at BC Housing, we begin our staff awareness program as early as March or April by updating our extreme heat and wildfire COVID response document. In this document, we address and outline the heat related risks, what the symptoms are and what actions need to be taken if staff think someone is in distress. We make sure staff are aware of all the tools available to communicate with our tenant base how to mitigate risks. As circumstances have changed over the years, we have updated the document to include mitigation of impacts of poor air quality. Similarly, when COVID-19 was upon us, we had to define the risks now imposed by the pandemic and the combined effects of heat, poor air quality, and COVID-19. We set up an internal procedure which also evolved over time to make sure we were aware of events that would pose risks to staff and tenants. Next slide, please. And to ensure that everyone knows what their role is, we created a matrix to address the pre-summer prep, the continuing summer roles and responsibilities, as well as a post-summer evaluation. What you're looking at here on the slide is the before summer prep, and it identifies who's responsible, accountable, supported, consulted, and informed in the matrix. The pre-summer evaluation involved roles, responsibilities for our health services staff, building managers, property managers, as well as the roles for staff that created and vetted the response document. Next slide, please. So part of the extreme heat and wildfire response includes a checklist for the staff at each site. We decided that this year we would create a checklist that included an area for the building managers to sign off and return to a designated person to keep proper records. This gives everyone a chance to review procedures and follows the matrix on who is responsible for the checklist. Meetings were set up at each directly managed site to review with the staff involved in preparing for the possibility of extreme heat events. The checklist reminds staff that if they have a chill room at their location, they need to make sure it's ready to go. And Louise will explain further. Back to you, Louise.
Okay, next slide, Carrie. Thank you so much. So yeah, thank you, Doug. And as Doug mentioned, and something Duncan spoke about as well in his presentation, is over the past number of years, BC Housing has really looked at protective measures of what we can offer for our tenants in our directly managed developments. So what we did is in our lounges or amenity rooms, we would create a cooling room or a chill zone for our tenants to come take advantage of. And depending what's available at that site location, we would have it set up with air conditioners, fans, etc., and also have displayed posters and information about ways to stay safe and healthy and prevent any health risks. We found it was a really good way to incorporate a community event. For the purpose of this picture, we have some staff from our People, Plants and Homes program, as well as some of our tenants, where we hosted a harvesting festival and invited tenants to come down to avail of the festival, but also to use the chill room to touch base with them, to check in with them, to say, how's it going? Do they have the resources? Do they use it as an information opportunity to create awareness and make sure that they can maybe share that with their neighbors? However, during the pandemic, obviously our lounges and amenity rooms were not operational. So last year we had to really relook at revising this and seeing, like, can we have these lounges operational in the event of extreme heat, and all these extra steps and measures we need to take. So we amended and updated our procedure in advance. We looked at it about March last year. So we decided to have the cool rooms operational again when an extreme weather event was declared, except a little bit different this time. We changed all our posters. We included like a COVID edition where we mentioned about, wear your PPE while you're using the space. If you feel sick, just to avoid using the space, but to reach out to our health services team or to call 811 for guidance about if you need to isolate during extreme weather. We also ensure that there is adequate supplies in the room, such as more hand sanitizer stations. We set up the rooms with disinfectant wipes. We positioned all the chairs and make sure there was arrows to try avoid any congestion, and those floor decals as well, just to make sure this chair stayed in the correct position. So we pre-set up that last year. Thankfully, we didn't have an event, but that's the same measure we're going to use again this summer in the case of an extreme weather event, just to have the rooms functional, operational. And also we're going to limit the number. We just have posted on each room as well, just how many tenants can safely occupy the space. The next slide, thanks Carrie, is Doug is going to speak to really quickly about the inventory reviews we do.
Okay, so over the years, we found that an inventory review is important to do no later than April if possible. Sometimes we don't know all the reasons that put demands on things like fans, AC units, and air cleaners. And this was the case this year as we discovered there are production issues worldwide and a greater demand for AC units and fans to outfit home offices. So we normally keep a small inventory of these items for emergencies only, such as equipment breakdowns in our cooling spaces and some site offices. The printed materials are important to keep stock of due to the longer turnaround required from a printer. I'm going to pass it back to Louise to talk about identifying tenants most at risk.
So as we heard earlier on the presentation, even though everybody is at risk of health-related illnesses during higher temperatures, there is a lot more groups of people who are much more vulnerable in these situations. And in line with the BCCDC, they have mentioned, seniors, infants, those people who are pregnant, people with pre-existing respiratory chronic illnesses are naturally just more at increased risks in these situations. So similar to that, our housing health services team within our directly managed portfolio, we created a vulnerable tenants checklist that we utilize in the summertime for poor air quality or extreme heat as a faster, more efficient way to check on those most vulnerable, given the vast number of tenants, like thousands of tenants that we served and are directly managed. So we would reach out to each development site staff ahead of time, and we would ask them to revise the list and to edit it and amend it as they see fit. And some of the guidelines we would use is to consider tenants who are, for BC Housing's purpose, we put the age threshold at 55 plus. We said those living alone in high-rise buildings, especially above the tree line. We also want to include individuals who may have physical illness, like I said, pre-existing maybe respiratory conditions that we're aware of, as well as psychiatric illnesses that Dr. Henderson mentioned, that those are mental health diagnosis may be more compromised, more at risk during these higher temperatures. So once all site staff receive that, they would relook at the list, and they would, in the sample below, they would input the tenant's name, and then we created a legend for more of a faster, effective way for checking on tenants in these extreme weather events. And then we would forward the list to an assigned team member in the housing health services just for tracking purposes. Another way we get prepared to support our most vulnerable tenant list is that we would ensure the staff who are checking on the tenants are fully aware of the information to share with the tenants. We would have key messaging that we want to review with them, like such as, when we're going to check on them, like, do they have an air conditioner? Do they have a fan? Like, do they need one? Are they aware of the internal in-house cooling area that we will be setting up? Are they aware of the community resources in the area that may have cooling zones that they can avail of? Do they have family, friends that can check on them? Do they have a neighbor they're worried about and they need to check on? Obviously, we're always reiterating the COVID protocols as well with the tenants, and checking if they have support services. Do they want us to continuously keep checking on them through this event? So those are the kind of tools that we offer to staff just to make sure that they're when they're speaking with the tenants. We also last year revised the procedure for identifying vulnerable tenants, and we obviously include a lot of COVID protocols where the staff would do pre-screening COVID check with the tenants ahead of time before they go to the door, just to keep both themselves, the tenants, safe. I'm getting all mumbled, and wear appropriate PPE. So the next slide here is just some communication materials that we developed within BC Housing. Obviously, we know a lot of the health-related risks and the seriousness during these higher temperatures. So we want to make sure we're doing our due diligence to get proper communication to both our staff and tenants. We felt it was much more effective to make the posters like simplistic, factual, informative, and also colorful, just so it grasps their attention. We do have two different versions of this poster, both available on our external website. One is before the pandemic, and this one is just including the COVID protocols that we included last summer and we revised. We also felt it very important just to have a lot of pictures. Oh, you can go back, Carrie, for 1 second. Thanks. I'm almost done. So we also felt it was important to include more pictures because a large percentage of our tenant population English is a second language, or they don't speak English. So we wanted to ensure that the messaging was getting across. And similarly, in the blue box below, we've added a link where if you're interested in creating a poster like this for your site, this is a link you can go to find similar information, just in different languages. And then lastly, just on the right here is something we created for our tenants. You can go back, Carrie. And just the last piece I want to mention. Yeah, perfect. Thank you. One of these mechanisms we created for checking on our tenants was we had a card where on one side was tips to beat the heat, and the other side was kind of a check-in that if health services staff tried to call them and go to their unit and there's no answer, we would leave this card on their door and date, time, ask them to contact the tenant information line recorded, and the staff would return the next day if there was no voicemail. And if the card was gone, they're obviously at home doing well, but if the card wasn't taken by the tenant, we would kind of execute the next steps just to making sure that they're staying safe and healthy in these higher temperatures. Now, next slide. Thanks, Carrie. So yeah, last slide is a lot of the material Doug and I discussed today is available on our external website. You can see and reference ways to set up a cool space, both indoors and outdoors. The policy that we created and that we follow and we keep amending is available for reference for everybody, as well as, health impacts, things to look out for, lots of reporting. So it's a great page to utilize if you want to reference anything or base it or share it with anybody at your other developments. So yeah, I guess that's it for us. For the next slide, we'll open it up to any questions. And also Doug and I have shared our contact information, our email, if you wish to reach out to us directly to ask any follow-up questions, if you want any of the materials that we shared.
Thank you. Excuse me. Thank you so much, Doug and Louise. And I feel like we could easily have another half hour of discussion and questions. And unfortunately, we're out of time today, so we're a bit over time. I just really wanted to thank you both for sharing. I loved the arc of the presentations today, starting with some of the science and then really moving into that people-centered lens of like, how does this impact the people that we're all serving in these buildings? Some of the principles about how to be responding, and then moving into really practically what are some things you can do, and some great tips and tools from BC Housing. So thank you to all of the presenters. Thank you to all you for being there and participating in the polls and listening. And Jackie has entered a link in the chat. It's an evaluation link for the session today. I know BC Nonprofit Housing would really appreciate any feedback you have. And I'm going to speak for the presenters. I hope it's okay, but if people have questions, I'm assuming they can also reach out and contact you directly. Okay, thanks everybody, and thanks for hanging in there. We've been a little over, but thanks so much for your time today.
Thank you.
Thank you. Great pleasure.
Thanks.